Hello everyone and welcome to Module 2. For the second unit that we'll be discussing, we're going to look at ophthalmology or the eyes. So with that, we are looking at two chapters this week. We're looking at chapter 26, pages 856 to 893, and chapter 39, which is pages 886 to 895. So let's go ahead and dive in and start talking about the units that will reflect around the ophthalmology or the eyes. So we're going to start with chapter 26, which is looking at the structure of the eye itself, looking at what the eye is composed of and what all we are looking at when we're part of this. So when we start discussing the eye, we're also talking about diseases of the eye. We need to know that the eye is a spherical filled fluid sac or fluid organ composed of structures that facilitate vision. Those structures are the cornea, pupil, lens, and retina. The nervous system plays a very large role with our sense of vision. The nerves of your eye control the amount of light that enters the eye through the pupil. It also helps to focus that light onto the retina by using the lens, and it helps to transmit results that we view and the images we view from the retina to the brain. So knowing that the nervous system plays a huge role with vision and what the eye is, we need to start talking about what the structure of the eye is. So the eyeball itself is housed in a cavity of the skull called the orbit. The eyeball is divided into two cavities, either the front or the back. The surface of your eye is made up of three layers. You have your outer layer, or the sclera, the middle layer, which also includes your iris, lens, and cellular body, and your inner layer, which includes the retina. Beyond that, there are structural structures or external structures that are associated with the eye. Those structures serve as a way to protect and support the eye from any foreign bodies. Those are your eyelid, the conjunctiva, the limicral apparatus, and the extringent eye muscles. Your eyelid is what closes over the eyeball and protects it from intense light, foreign matters, or any impacts. The conjunctiva is a mucous membrane that lines the underside of the eyelid and the anterior part of the eyeball. The limicular apparatus is where tears are produced, stored, and removed. So now that we understand the structure of the eye, what it is, and what systems are all involved, it's now time for us to discuss some common disorders that are associated with the eye or ophthalmology. The first one I want to talk about is an astigmatism. This is a condition caused by an irregularity in the curvature of your cornea or your lens. It's characterized typically by blurry vision, and you could also have some squinting or headaches. Typically, this can be treated with glasses, contacts, or any sort of eye surgery to reshape the cornea. We can have what we call cross-eyed or wall eye. This is where the patient has a disorder that they may have problems with depth perception and double vision. Again, treatment will include glasses or contacts, but then you'll also typically have where patients will wear a patch over the stronger eye to actually help force the weaker one to become stronger. It's sort of like an eye physical therapy. And of course, there is surgery as well for this. We have a term called myopia, which is also called nearsightedness. Now, nearsightedness means that patients have difficulty seeing things that are far away, but they can see things that are close up very well. Hyperopia is also called farsightedness, again, meaning patients can see far away, but they struggle with what is close up to them. and presbyopia, which is similar to farsightedness, but it's directly related to that of an aging process. So it's farsightedness caused by age. All right, so that is actually going to wrap up chapter 26. It's a fairly small chapter that we need to discuss there. I am going to encourage that you read all of those pages fully, as I didn't discuss everything, just sort of the main topics. Now we're going to move on to chapter 39, which is actually talking about ophthalmology. So this chapter discusses the study of and care of the eye. The branch of medicine that deals with the structure, function, diseases, all related to the eye is called ophthalmology. You can have an ophthalmologist, which is a medical doctor who performs exams and surgery, and they also can prescribe medications, glasses, or contacts. Likewise, you can also have an optometrist. This is a technician who specializes in the grinding of lenses and preparing glasses or contacts. They don't actually do any of the prescription writing, so that's the big difference there. Now, there are a number of different types of eye exams that can diagnose and treat vision problems. Most can happen in your primary care office, such as the routine screening exams for vision. When you're doing a visual exam, the provider will look at the patient's pupils as well. Now, there's an acronym that we use to discuss the eyes, and that is called PERLA. And that stands for pupils equal, round, reactive to light, and accommodations. But there are some other abbreviations that we use, such as OD, OS, and OU. OD stands for right eye, OS stands for left eye, and OU stands for both eyes. Now, when doing any sort of exam, the medical assistant will test what we call visual acuity or clarity of vision. And with that, when we're looking at that, there are a couple of different tests that we perform. The first one is a visual acuity testing. The medical assistant will be responsible for assessing visual acuity, such as distance acuity, near vision acuity, and color vision. So when we're looking at this, the first one that we do is distance. And distance is measured using what we call a Snellen chart. This is a chart that places the largest symbols at the top, and they go decreasing in size as they go down the chart. Typically, it starts with a very giant E. And everyone knows this chart if they've seen it. For children who are younger and maybe don't know their letters yet, we have symbols that we can use instead of using letters. Typically, your patient will stand 20 feet away and read each line. The result the patient receives is the last line that they can read without any squinting or mistakes. Even if it's one letter mistake, it's still a mistake. And the results are read as a fraction. So for example, if your patient had 20/60 vision, like I've given here, this means that at 20 feet, they can see what others would see at 60 feet. That's how you read that. And when you're doing this exam, you do both eyes, right eye, and left eye. If they wear corrective lenses, such as glasses, you'll do this with and without the glasses. But if a patient has contacts in, we typically don't ask them to remove those before the testing. Near vision acuity is done when a patient's having problems reading or performing tasks that are close up. This type of testing is done with what we call a Jaeger chart or a Jaeger card. The patient will read the card and hold the card at a normal reading distance away, which is typically 14 to 16 inches. The card has a series of paragraphs in decreasing size. And we read this result based on the number that is above the last paragraph that the patient can easily read. With this one, we're not doing right eye, left eye, both eye. We're just simply doing both eyes. And the last visual acuity testing is going to be that of color vision. Now, this is the inability to distinctly differentiate colors of the spectrum. Defects in color vision are either from birth, or meaning that you're born with it. They can be inherited, or they're acquired through some disease or injury. The test that we use to determine color variance is called the Ishihara test. It's a printed card or book with single colored dots illustrations containing a number, curved line, or shape. The patient is shown 14 cards and they must identify 10 of them to be considered having normal colorblind or color vision. Now, with this, just doing visual acuity testings, medical assistants are also responsible for a couple of other testings, such as eye irrigations or installing eye medications. An eye irrigation is where you will rinse the eye to remove any foreign substances or chemicals that have been in there. This requires the use of sterile techniques and equipment. And you'll want to make sure that the patient is sitting or lying down. Typically lying down is easier. And you're going to have the patient tilt their head so the affected eye is actually facing downward. And I say this because you don't want to have that irritant come from the good eye from the bad eye into the good eye. So you put the bad eye down so that way it can run into a basin or some sort of object to catch that. You'll open the patient's eye with your index finger and your thumb of your dominant hand, and then you'll use a syringe with sterile water to irrigate the eye. You'll continue this method until that irritant or that substance has actually been removed from the eye itself. And you can also install eye medications. This is something that medical assistants will perform and instruct patients how to do themselves. This can be clinical, or even if it's in sort of a prompt care setting, this is something you will be responsible for. It's similar to an eye irrigation, so patients will sit, in this one it's a little bit easier, and they'll tilt their head backwards and look up at the sky. Then the medical assistant will pull the bottom eyelid down and they'll hold the dropper about half of an inch above the eye and apply the recommended drops or ointment as prescribed. Once that is in there, you'll want to let go of the patient's bottom lid so that way they can blink the medication through the entire eye and teach them how to do that themselves. All right, so that's going to wrap up this final chapter of chapter 39. What I want to take a few seconds on is talk about your homework for this week. So this week you only have a discussion board. And for your discussion post this week, what you're doing is you're looking at and you're discussing the topic of 2020 vision. Now you'll need to do some research and discuss what, if you think 2020 is the best vision possible for patients to have. You'll also need to discuss if it's bad if a patient cannot see or does not have 20/20 vision. And your initial discussion post will be due on Tuesday, October 10th by midnight. And you'll need to reply to at least one classmate by Saturday, October 14th by midnight. Again, while I appreciate if you respond to me as the instructor, it does not count for your grade. Again, I'm going to stress and hope that you all have been looking at the rubrics that I use for grading, because the rubric for the discussion post is very detailed. It's very specific. So I want to make sure that you're looking at that and you're actually using that rubric as you're writing out your discussion board so you can get the most points possible. If you guys have any questions, comments, or concerns, please make sure that you reach out to me either via email in Blackboard, or you can reach me at the Rockford campus, which you can find my phone number for that on your course homepage in the top right-hand corner next to my photo. I hope that you all have a wonderful Module 2. And again, if you have any questions, please make sure you're reaching out to me. Bye, everyone.